Happy 4th of July! So this 4th of July, we've got 4 tips for you that we use for all of our patients, regardless of all walks of life and whether you have an injury in your neck, your back, or your head, wherever. So you're gonna learn how to sleep better, stand better, breathe better, and have better hamstrings for a better back. Sleep! How many of you are sleeping well, or at least well enough to recover from your day-to-day stresses? What we've got planned ahead is to teach you sleeping on your back, which actually reduces your spinal load the most. And if you prefer to sleep on your side, well, let's teach you a safer way to sleep on your side. I wouldn't prefer it, but if you have to do it this way. Let's get down to some commonsensical things. You sleep well, you'll heal well, and you'll be independent from pain. So, you need a few things. 2 bath towels, 1 like hand towel. You need 3 pillows. We prefer down feather pillows, but if you don't, that's okay too. All right, so what we're gonna do to get you to be independent from pain is sleeping on your back is generally the best. You're going to need 2 pillows. 1, I tell people, is to butt against your butt. Another, underneath your knees, so it stacks up like that. And this is how I would set myself up. Now, those of you who are cuddlers, as you know, you're gonna get yourself some cuddling injuries. So it's best to kind of sleep by yourself, or at least on your side of the bed. So the next one you're just taking, and depending on the firmness of your mattress, that's important too. You just want to fold it there. That's gonna go right by my waist. So I'm setting myself up right now, like so. And then I like generally the pillow that goes underneath my neck. So we want to stick this away from not just the base of your neck, but underneath your shoulder blades, because that's your pivot point. It keeps it from rolling too much. If I had it up here, I'd roll a lot. It just doesn't feel stable. So right there. And then those of you with shoulder or neck discomfort, just take your bath towel, fold it into halves, stick it between your shoulder blades. Like so. This is how I do it every day. My fiance thinks it's excessive, but you know what? Life's too short to be uncomfortable. Like that. All right, so if you transition from your back and you like to toss and turn, if you toss and turn, you're generally not in a position of comfort, but you're gonna take the pillow, especially if it's a down feather, stick it right here. So you're trying to protect your spine. And then you're gonna create a little trough. With the pillow that's in your neck, you can fold it nicely. We'll make it look a little nicer. Fold it in half. And that should butt against your upper shoulder. You can take the ones, your towels generally, you know, they can all end up here. And then with the pillow between your legs, stick that into the inseam, encompass your knee, hip, ankle. And then that's it. We've talked about this before, so you know it's important. This is your standing alignment, your standing posture. Those 4 dots that we've talked about, or hang 10, we're gonna go over it once again. Let's start at our feet. What we wanna do is, most of you are actually in the heels, and if you can pick up your toes, you're too far backwards. So what we wanna do is you wanna get yourself over that midfoot right here. And so I would tell you it's more of a lean, or more of a hinge, or a translation forward. Then what you want to do is align those 4 dots. We've talked about that before. 1, your pubic bone. 2, your belly button. And 3, that chest plate, that bottom part, a little tender here, and the base of your throat. So 1, 2, 3, 4. That's the best alignment. If you're like this, if you're like this, if you're like this, all these different postures are really you want to get away from. So 1, 2, 3, 4, and we've talked about this before, the hang 10, that and that should touch. So if you're too far back, your heels are back, you may go this way, but you want to be able to tip 1, 2, 3, 4. And you can practice in front of that mirror and really gauge this to be the right alignment. That you just witnessed is a deep diaphragmatic breathing, or what my mentors have called wavy gravy. This is the only exercise that I can't help you with. You have to do it yourself. So the importance of the diaphragm we've talked about in our blog, but I want you to read that there are also more benefits to the rib cage and the diaphragm for our life, and also decreasing pain. So stay tuned and we'll get back to the wavy gravy with you. The best way to do this, you saw it in sitting, but on your back is probably the easiest because there's less gravity. That diaphragm right around here. So that's kind of the shape. It's like an umbrella or a parachute or a mushroom shape. What we want to do is bend your knees, and then what you're going to do is you're going to inhale 50% air, just 50% capacity, not a full breath, half breath. So then what you're going to do is you're going to try to move that air like a physical bubble or a physical ball up and down. You're trying to massage all the stuff on the inside. So you might cramp up, you might move some nerves, all that stuff. All that stuff's going to really help that circulation and reduce your stress. So what we want to do is you're going to inhale. About 30 seconds. So I don't want you to pass out, obviously. So 30 seconds, about 5 repetitions or so. You want to go here and here. So I'm just pointing. I want you to see that I'm not using my hands and I'm not doing anything weird with my back. It's all coming from the inside. Think of a toothpaste or a toothpaste tube. You're really trying to squeeze that up so that abdominal helps out, and then it relaxes. Up and then down, up and then down. Now, if you really get good at it, you could try doing different shapes with the bubble. You can go side to side, X. You can go Z's. Those get tougher. So, just to show you that that's possible. Then you can go this way. And that takes a lot of control of that diaphragm and protects your spine. We all know how much I care about the hamstrings here at Rehab and Revive. We've got another exercise, which is a little progression from others. We're gonna do it with 2 legs, the double heel slide. That hamstring, so important. If I go down in this world, this is the thing I wanna be remembered for. How important the hamstring is for that lower back and that spine. So the double heel slide is actually gonna help a little bit of the lower abdominal and these hamstrings to set your hips in the right place. So this is what it looks like. You're basically gonna dig into the table, engaging your hamstrings and soft quads. Then what you're gonna do is you're going to slide and really dig down like you're at the beach digging into the sand. So slide this way using these soft. So you can start again, slide and really pull. You're trying to pull, you're trying to create as much friction. That's why I've got this towel here. Trying to pull and really get these guys. And you're only allowed to go as high as your quads aren't kicking in. So you, in a perfect world, you're getting close to your heel to your butt. Just do this for a few minutes, and that's really going to help strengthen. If you're doing it right, you're also feeling it in that lower abdominal. And that's like a reverse crunch almost. So give that a shot for the next couple minutes. So hopefully these 4 tips help you become more independent from pain. Check out that wavy gravy because you're gonna need to blow on your spinners a little bit longer and faster and get some speed on them. So there we go. Please check with your healthcare provider and make sure these are the right exercises for you. I'm Dr. Lin of Rehab and Revive. Remember, we heal smarter, not harder.